Guys, you guys are welcome. Today I'll be talking about the optic chiasma. I will not really be talking about the optic chiasma directly. I'll actually be sharing to you guys one question they asked me in one of my oral examination. Okay, so they were trying to refer to the optic chiasma, but they were coming through the other side. Okay, so the question was fibers leaving the eye cross at where? Okay, so now it's for you guys, it's for you to know that you have to think, okay? So you know that the optic chiasma is where fibers leaving the eye, okay? So one fiber here, and where they cross is where they call the optic chiasma. I wanted to use the blue ink, but let me just use the red ink, okay? Since it is more, okay. So now they said that fibers leaving the eye cross at where? They ultimately cross at the optic chiasma. Okay, so having given the answer that optic chiasma, the examiner will still be looking at you like, okay, optic chiasma, and then so what? Okay. So if you just say only optic chiasma, it's just like you are a student that cramps. Okay. So you have to explain what is the optic chiasma. Okay. So let's go down to this point. We say that the optic chiasma is the point where the optic nerves from each eye unite to form the optic tract. Okay. That's speaking about the optic nerves. Then this for you to know that the optic nerve have different fibers. Okay, it has like two different types of fibers. So now at the optic chiasma, that's you going on details now. Fibers from the nasal, that's medial halves of each retina, cross over to the contralateral optic tract. All right. Now, why fibers from the temporal halves remain ipsilateral as they go? Let me explain this. I see that these fibers medial, okay. What is your eye medial to? Your eye is medial to the nose, okay. So that's why they call them nasal fibers, okay. So now, what's the name of this bone here? If you know the anatomy of the skull, this is a temporal bone, okay. So now, fibers away from the nose are called what? Temporal fibers. Now you can see that these temporal fibers in green, they don't cross, they move on the same side, okay. Now same side is what they call ipsilateral, okay. That's just like the medical term for it. So they move on the same side, okay. While fibers from the nasal halves cross at this place, okay. And when they cross at this place, do they still move on the same side? No, they move to the opposite side, okay. So that's where this contralateral come here, okay. So fibers from the nasal medial halves of each retina cross over to the what? Contralateral optic tract, okay. So when they cross, this one cross here, this one cross here, okay, making up a very significant landmark, okay, and that's what they call the optic chiasma, okay. So now let's move on. We said that within the middle cranial fossa, the optic nerves from each eye unite to form the optic chiasma, okay. So now at the chiasma, fibers from the nasal medial halves of each retina cross over to the opposite side as a contralateral optic tract, okay. While fibers from the temporal halves remain what? Ipsilateral. Okay, they remain on the same side. Okay, so that's it. Another image showing the optic chiasma where the fibers cross. Okay, from the nasal ends, they come to the middle cranial fossa and they cross up. Okay, so I hope you guys understood this lecture. Just a tricky lecture from tricky question from my lecturers. Okay, so see you guys in the next bye.